The World Federation of Neurology has partnered with the International Parkinson's and Movement Disorder Society to mark the 6th annual World Brain Day. The World Brain Day is observed annually on the 22nd of July, and this year's event is dedicated to raising awareness for Parkinson's disease, a neuro-degenerative brain disease that affects the mind, movement, and almost all aspects of brain function. To talk to us a little bit more about this via Skype, we're now joined by Professor Jonathan Carr, who's the head of the Division of Neurology at Tygerberg Hospital and Stellenbosch University. Prof, thanks very much indeed for joining us. Good evening to you. Welcome to the program.
Hi, Peter. Thanks for having me here.
All right, so just how important is a day like today? I don't think that people have a sense of how many brain health issues are in existence.
I think you're absolutely right. The brain's a complicated organ, and I think that perhaps the biggest change that we could affect is just to shed light on many of these terrible conditions and of the awful conditions that can affect the human brain. I think Parkinson's is really pretty much at the forefront. And really, I think one of the big things that people with Parkinson's suffer from is simply a lack of understanding of the illness by people they meet every day in the street. So the more information we can pass on, the better that would be.
All right, let's talk a little bit about Parkinson's then. I think most people, because of celebrities like Michael J. Fox, are starting to be aware of it, and most people associate it with tremors. But there's a lot more that goes on, I guess. Take us through the process of Parkinson's to the point that we start to see these physical symptoms.
Okay. Well, I think firstly, the very interesting thing about illnesses like Parkinson's is very clearly they start 10 or 20 years before the tremor starts. And that's something we've really just been finding out in the last couple of years. So that's very interesting. As you say, tremor is the most recognizable feature, but Parkinson's it's I guess a bit like the computer in your car that's starting to malfunction. So you lose all sorts of functions, and that's really why it's an awful illness, because so many things are affected. So it would be really quite limited to think of it just as tremor. That's what I think many people do, understandably, because that's the obvious link that we all have. But Parkinson's affects the way we think. It affects sleep. It affects very basic functions such as blood pressure, et cetera, et cetera. It really, the brain commands the body. Parkinson's damages the brain. It's inevitable that all brain function ultimately is affected to a lesser or greater degree.
Okay, so Parkinson's is progressive. You've said it starts 20 years before we start to see the symptoms. What are the first signs usually that causes people to go see a doctor and then perhaps a neurologist?
I think absolutely it's what everybody knows. Mostly it's tremor, although there certainly are quite a lot of people who have Parkinson's disease who don't have much tremor, and they are troubled by really the dominant feature of Parkinson's disease that nobody is aware of because it's lack of movement. So people who slow down, and again, everybody I think is aware of slowness, but that's really the major cause of one of the major causes of disability in Parkinson's is just slowing down. And I think in Africa, particularly where access to healthcare is often quite limited, people might just attribute slowing down to natural old age. And I think that's something that we need to illuminate and work on in terms of delivering education to our population.
Is Parkinson's age related?
Very much. So again, there's always been a big question, and there still is. Is Parkinson's as common in, for example, Black South Africans as it is in white South Africans? And we don't know. But we've got to bear in mind that our demographics are such that we're a very young country. We don't really have that many older people as compared to, say, the United States. So the major risk factor for Parkinson's is, in fact, just simply old age. So in many countries, it's a disease that's, in fact, not treated by neurologists, but by geriatricians who specialize in the treatment of problems of the elderly.
All right, talk to us a little bit about the pathology. What actually starts happening in the brain that starts causing some of these symptoms and the diminishing of various functions?
Okay, I think it's good to firstly emphasize that the brain is not a single structure. Again, think of it as a car with many constituent parts, and they all have their role to play in getting the car from point A to point B. And some of those parts are naturally, the analogy would be in Parkinson's, some of those parts would be susceptible and others would not be, or would only be affected much later. So clearly we would know that the bits of the brain that are involved in the motor system are very much affected. And that's because the cells that make the substance dopamine are affected quite early on in Parkinson's disease. But I think I'd like to get the point across that Parkinson's is not just a dopamine deficiency, which I think neurologists such as myself have always believed. It's really becoming clearer that it's an illness that affects many bits of the brain and the nervous system. And in fact, interestingly enough, far from proven, but current theories, one of which is that bad proteins rise up from the gut via nerves and then enter the brain and trigger, if you want, a cascade of bad proteins that lead to more bad proteins and so on and so on. So you ask about the fundamental pathology, and that is generally, again, shared by most neurodegenerative illness, which are illnesses where brain cells become sick and die too early. Most of those are characterized by accumulating too much bad protein. And we all have mechanisms to clear bad protein, but whatever is triggering that bad protein accumulation just overwhelms those defense mechanisms, if you will, and eventually the cell can't cope and the cell dies as a result. And clearly some cells are very vulnerable, but with time more and more cells will succumb to the effects of those bad protein accumulations.
I'm going to ask about treatment, but I guess it's more about managing the degenerative condition, isn't it?
Sure. So the holy grail for any neurodegenerative disorder would be to diagnose it early and to stop it. And, the common neurodegenerative disorders that affect mankind are Parkinson's disease, Alzheimer's disease, and motor neuron disease. And they all have a lot of similarities in that they all are, to some extent, characterized by accumulation of protein. So one major goal of treatment would be to stop that protein accumulating and to stop it spreading from one cell to the next. As we speak, there are active, or before COVID, there were active vaccine trials to try and clear the protein, and that's been attempted for quite a few years without success. But I think it's reasonable to expect that that's going to be a technological issue, as in the major determining factor is there's bad protein, how do we clear it? And then you have to overcome the hurdle of what are the mechanistic problems of getting the medicine where you need it to be and making sure it does its job. So that's really, as I said, what everybody wants with a degenerative disorder. Because when degenerative disorders start, as we all know, they're not bad. You might have a bit of forgetfulness and you have a test and the doctor says you have early Alzheimer's, but you'd be okay if you could stay at that state. And the same for Parkinson's. Any Parkinson's patient has a little bit of tremor, might be a bit embarrassing, but they'd get used to it if we could stop it. So I think the tragedy, the sword of Damocles for Parkinson's is the knowledge that you're getting worse. Right. And it's not every day, it's not every month, but next year is going to be worse than this year. And everybody wants to know, and they also don't want to know, how will I be in 5 years' time? How will I be in 10 years' time, etc. So I think that's the awful thing about it, that, you have the illness 100% of the time, and you're going to be aware that you're getting worse. So everybody truly wants some treatment that can prevent progression of disease. And I fear it is unfortunately true that in 2021, we don't have that. But I think we're hopeful. And that's not a false hope. It's based on wonderful scientific experimentation that is robust and sound and should ultimately yield good results.
In the meantime, families, friends, and people are coming across and will have people in their families with Parkinson's. And one of the difficulties, I'm sure, is when the speech goes and the movement is slow, there's sometimes a perception that the person can't hear, is not understanding, but that's not always the case, is it?
No, you're so right. This is just a natural tendency, and I think it's true for anybody who has difficulty communicating, that they're overlooked. And I think it's something that society needs to pay vastly more attention to. But it's very, very difficult. There you have an elderly patient who had a disease for a long time. And as you say, sometimes they're virtually inaudible even to their spouse, and they have trouble moving, so they can't write. It's a very awful situation for them, and particularly for their caregivers.
All right, perhaps finally, some people might be concerned. Is this something that, we go for our annual prostate checks? Is this something perhaps that we should be doing regularly, once a year maybe, just to get a test to see if there's early onset, and then it's easier managed, I guess, if you know early?
Peter, this is a big topic in a way, but I think I have to tell you that all screening tests are fraught with difficulty.
Right.
So they're very attractive, but they really are problematic. Whether that is, I'm not going to get into cancer, it's beyond not my field, but all screening tests are problematic. I have to tell you, if I were talking to you right now, were to be diagnosed with Parkinson's today, I wouldn't take any medicine at all, because I'm okay. There's nothing I can take to prevent my illness getting worse, at least in 2021 and probably 2022. So screening would do nothing but make me...
All right, it looks like we've lost Professor Jonathan Carr. But thanks.
And I think the ones...
All right, it looks like we've lost you, but I think we'd come to the end of the conversation anyway. So thanks so much indeed. And I think it's important that we all become very aware of Parkinson's and other brain health issues going forward. And thanks so much for joining us on World Brain Day.
Great pleasure. Thank you, Peter. Take care.
Thanks so much. All right, that was Professor Jonathan Carr speaking to us about World Brain Day and a focus on Parkinson's disease. We believe that as many as 7 million people get diagnosed with Parkinson's every year.